Due to our increased knowledge in the world of biology and psychology, the fields have become highly specialized and have become disconnected from one another in the world of psychiatry, when in reality they should really be interrogating their advances in how we treat patients today. We can potentially unite these two fields by investigating models of how psychotherapy affects the brain, specifically in the way memory can be modified. Neuroscience is paving the way for uniting our newfound understanding of psychology and biology and gives us many opportunities for developing more integrative treatments. Sadly, advances in our knowledge have created a one-dimensional approach in how the medical world treats both mind and brain separately. Consequently, the mind is treated with psychotherapy while the brain is treated with medications. Kendall's research on creatures like the marine snail have broadened the connection between learning and alterations of gene expression, and the strengthening of synaptic connections. Other studies on mammals have demonstrated the connection of how the brain has changed and adapted to input from its surrounding environment. For example, negative parenting behavior has a direct link to their children's mental illness. If we view psychotherapy as a form of learning, then we can conclude that it too can have a psychological effect. There is an amazing mutual influence between our environment on our minds and vice versa, the way our thoughts influence our body. Neuroscience is helping us find a way to reserve the damage done by our environment and thoughts. If we observe how the damage is done, we can apply this process in building healthy models for change. For example, Soane's research on the rhesus monkeys proved that a nurturing environment can produce lasting biochemical changes that limit the potential damage done by genetic vulnerability, which was created by stress and anxiety in the first place. From this we can learn how to undo the damage done by past traumas on the body. By treating the mind, in turn influence the physical health of the brain. Researchers in Finland show how through psychodynamic therapy they were able to influence the serotonin metabolism and consequently help a man suffering from borderline personality disorder and depression. Cognitive behavioral therapy also seems to have had an influence on the thyroid hormone levels, greatly reducing the effects of those suffering from severe depression. The ideal goal is to achieve a balance between psychotherapy and pharmacology and defining the differences between temperament and character in the patient who will need a customized treatment plan. In short, we can educate families how to interact in ways that will make their children physically healthier. Combine psychotherapy and medication in ways that are more efficient and effective in treating specific disorders, and choose appropriate strategies for temperament with medication and psychotherapy for character issues. The field of neurosciences still has to adequately document and prove the extent in which the brain can be changed through psychotherapy, and researchers have yet to prove the link between the research on animals and their effectiveness on human subjects. But overall, it is an existing field which have tremendous potential for success.